What does the prostate do, and what is the prostate-specific antigen? The prostate's only real function is to make fluid for semen. The prostate is right under the bladder, so as men get older, the prostate can get bigger and block the flow of urine. Prostate-specific antigen, or PSA, is a protein made by the prostate. In the 80s and 90s, we began to realize that the higher the PSA level in the blood, the higher the risk of detecting prostate cancer. Who gets prostate cancer? Those most at risk for prostate cancer include smokers, anyone with family members who have had prostate or breast cancer, those with certain genetic changes such as BRCA mutations, or certain races such as African American and Caribbean men. The National Cancer Guidelines, NCCN, recommended starting PSA screening as early as age 40. If the PSA level in the blood is low at age 40, the test may not need to be repeated until age 45. We know that PSA screening saves lives by detecting prostate cancer earlier, but it can also be falsely positive. Factors that can falsely elevate your PSA level include having a larger prostate, stimulation of the prostate from intercourse or masturbation prior to the screening, urine infection or inflammation of the prostate, any activity that can stimulate the prostate, such as a long bicycle or motorcycle ride. The PSA level can also naturally fluctuate from day to day. One study found that 25% of the men with high PSA levels dropped down to a normal range the very next day, with no change in activity. The PSA level test is still the best test there is to determine the overall risk of finding prostate cancer. Other tests may help to improve the accuracy of the PSA level test, such as a prostate MRI or a blood test called the free PSA. A prostate biopsy, which is a quick 3-minute procedure, is the only way to confirm if there is prostate cancer. The risks are very low and include the risk of bleeding and the risk of sepsis. Blood in the urine or stool can last for 1 to 2 days, and blood in the semen can last for 1 to 2 weeks. Sepsis is a serious bacterial infection that could result in hospitalization for several days. The chance of contracting sepsis nationwide after a prostate biopsy is about 2 to 3%. At Penn Medicine, our rates are less than 0.5%, or less than 5 people out of 1,000. This concludes our video on the elevated prostate-specific antigen, or PSA blood test. Have a question? Come prepared to discuss your questions at your next office visit, or call us at 215-622-2891.